I'm Jennifer Cass. I'm the clinical coordinator for neuropsychology, and as part of that, I am involved a lot in program development in our neuropsychology area, but also providing clinical services. So neuropsychology really is involved in assessing children that have different neurological or medical conditions that might impact brain function in some way. So we were largely involved in evaluating cognitive function, but also mood and behavior, and hopefully providing recommendations that will help the child adapt to whatever difficulty they're having and help the family and school provide the supports in their community that they're going to need to succeed in life. So we see a wide range of kids. I'd say most of them are referred from our neurologists. We see lots of kids with epilepsy, brain tumors, traumatic brain injuries, genetic conditions. We work a lot with our 22q deletion center, cleft lip and palate. So a pretty wide range of kids that are facing some pretty significant at times medical conditions that are affecting how they're functioning, their mood, their behavior, and how they do in school. I think, there's a lot of different things. I work with amazing colleagues that some of them I've worked with, again, for 12, 13 years, and we are a pretty tight-knit group, and they're just really amazing to work around and see everything that they're developing in their areas and just how they've really expanded services throughout the hospital. But I think it's really just interacting with the kids and families. Like today I walked past the sibling playroom, and there were these squeals of delight and joy, and these kids were like losing their mind because they were gonna get to go in this room and play. And that's a pretty cool thing to be able to witness every day, is just being around an environment where you're working with kids and they're so resilient. They're coping with things that you or I have not experienced in our lives, and there's still that joy there, and you can see it and you get to feel it. One of the things I was thinking of, so the marathon is a huge endeavor here now that Nationwide Children's Hospital is involved in that. And one year I had done an evaluation with a child. It was a very sad and difficult case of a child with a progressive form of epilepsy that was really struggling. He was one of our patient champions. So myself, along with one of our other neuropsychologists, and many of the folks that had worked with this child from our epilepsy team, hung out with him and his family the full day at the marathon. He was like, we were at mile 20, and I had never really watched the Nationwide Children's Hospital Marathon, and it was just such an amazing experience to spend that time with that family and get to know them more, and just see the degree of support that they had, and just that the marathon was providing for all the patient champions, and just the fundraising that they do. And because of that, I was like, God, I hate running. I hate it. But I think I can do this. And so the next year I trained, and I did the half marathon, and it was amazing to give high fives and to every kid at every mile. And a lot of the kids that are patient champions, behavioral health has touched many of them in some way. So pediatric psychology, neuropsychology, or psychiatry, or some of our close to home centers, our outpatient therapists and things like that. So it was amazing that I was able to meet that goal, and also do some fundraising for the hospital as a children's champion too.